Welcome to the Health Literacy Communications Corner from Cook County Department of Public Health. This video was created through a partnership between Cook County Department of Public Health and LiteracyWorks. Let's talk about using Teachback at work. Teachback is a strategy that you can use to make sure you're explaining your ideas clearly. You may have heard of it as a way to check for understanding between doctors and patients, but you can also use it in a variety of settings. In the workplace, Teachback can be helpful when you're sharing new information, splitting up tasks, or agreeing to next steps. It's useful because we don't know what we don't know, so we don't always know what questions to ask. It's often not until we try to use the information shared with us that we realize gaps or misunderstandings. By using Teachback, we can identify these gaps and misunderstandings earlier and in a supportive space where we can correct them. In this video, we're going to start with an example of communication gone wrong. Then we'll review what the Teachback strategy is and apply it to our example to see what it looks like in action. Meet Hector and Maya. They work together at ABC Community Health. Today, they're meeting to plan for an upcoming health fair at the local community college.
The fair is on Friday at 1 p.m. I usually arrive 20 to 30 minutes early, so I have plenty of time to set up. We'll need to bring the new program flyers, the event box, and a sign-up sheet. What would you like to take care of?
I'll print the flyers and the sign-up sheet.
Great. I will bring the supplies box.
They wrap up their meeting feeling confident about the upcoming health fair. The day of the fair, Maya arrives at 12:30 to set up their table. When Hector isn't there by 12:45, she's worried he forgot, so she sends him a reminder email. He responds that he'll be there soon. When Hector arrives at 12:58, he greets Maya and starts setting up his part of the table. Maya is annoyed that he doesn't apologize for being late. Hector is just relieved that he made it there on time. Then Maya looks at the flyers Hector brought.
What are those?
The flyers?
Those are the old flyers.
Oh, I didn't know there were new ones.
I said to print the new ones. They were emailed out last week.
Well, that could have gone better. Hector is confused and doesn't understand why Maya is mad at him. He feels like he made just one small mistake. Maya is frustrated because Hector was late and brought the wrong flyers. She feels like he doesn't care about the work and doesn't want to work with him again in the future. Let's talk about how Maya and Hector could have used Teachback to avoid this confusing situation and harming their work relationship. There are 4 main parts to Teachback. First, you want to focus on one idea at a time and introduce it clearly. When it makes sense, use visual aids to support the information you're sharing and to help with understanding. You want to take responsibility for the information. That means explaining that your goal is to be clear. You're not trying to test your audience. And we do this by asking open-ended questions, not questions with a yes or no response. Let's rewatch Maya and Hector and see what happens when they use Teachback. This time, they start with a shared document to keep track of their notes. Using a shared agenda and note-taking document helps them stick to one topic at a time and provides a visual aid. They can both reference the notes as they need throughout the conversation, and it's something they can look back at later.
I like to arrive 20 to 30 minutes early to set up, and I want to make sure we're on the same page. What time can you arrive to help set up?
I'll be coming from another meeting, so I don't think I can get there until almost 1. Since I can't help with the setup, I can say after you clean up.
That works for me.
After sharing her preference, Maya asked an open-ended question. That helped Hector share important information, and they could find a solution that worked for both of them. After figuring out the schedule, they moved on to what they needed to prepare. As they discuss each task, Maya adds their names to the shared agenda.
I want to make sure you have everything you need. Which flyer are you going to print?
The same flyer I used last time. It's in the shared drive.
Maya's open-ended question revealed that Hector didn't know which flyer to print. This was a significant source of their conflict earlier, but this time she had a chance to correct it. When misunderstandings come up, it's important that we listen for and validate correct information. We want to make sure that our audience knows what they did get right. We want to try and name the source of misunderstanding to identify where we were confusing or if there's a gap in knowledge. Then we can kindly and clearly restate the information and ask a follow-up question to make sure we were clear this time.
The shared drive is the right place to start. From there, you want to find the flyer that says Winter 2026. You know it's the right one because the program dates start in January 2026. Can you show me which flyer you're going to print?
Sure.
After clarifying the source of confusion, Maya asked another open-ended question to make sure Hector knew what to do. In this case, she asked him to model the task so they could both feel confident that he could find the information in the correct place. This time, the health fair goes smoothly. Both Hector and Maya are happy about working together and look forward to working together again. So remember, Teachback is a way for us to make sure we're explaining ourselves clearly, and we can use it with any audience. We want to focus on one topic at a time and be as clear as possible. It's helpful to use visual aids when we can, and we want to stick to open-ended questions. Teachback is a tool, not a script, so it's going to look and sound different every time you use it. Try to keep a casual, friendly tone, and remember, the most important part of communication is having authentic conversations. So just be yourself. If you're interested in learning more about how this fits into organizational health literacy, or want to learn more about organizational health literacy in general, check out our toolkit. You can find it at healthliteratecookcounty.org. There's also a link in the description below this video. Thanks for watching.